Adam Fisher, welcome to your podcast, Advanced Spinal Care Podcast.
Thank you.
Thank you. So we started this YouTube channel just for this conversation,
Okay.
for people to get to know you better, and for people that really don't know you. Who are you?
Well, I'm Adam Fisher. I'm Australian. I graduated as a chiropractor 30 years ago in Australia, Sydney, Australia. And since then, I've been practicing as a chiropractor in Australia, England, for a short while in Brazil, and now Portugal.
And what do you really do?
Well, chiropractic is all about getting the spine to function properly, because the spine affects the nervous system and the nervous system affects health. So if we can get the spine to move as it should be moving, the nervous system functions better, less pain, of course. Pain's the first sign and symptom. But then it can also have an effect also on how the body functions.
And how did chiropractic come into your life? What was the beginning of everything?
For me, it was back when I saw a chiropractor myself, back when I was still at school. I had a rugby injury, and the chiropractor fixed it relatively quickly, just in the back. And I got interested in it after exposure myself.
You are originally from Australia, but how did your journey come up to Portugal? How do you come? An Australian guy comes to Portugal.
Let me think. In '99, I travelled to I was practicing in Australia. Wanted to see the world. Went to the UK. Was working there for 10 years. Met my ex-wife, and we travelled to Brazil, and then on to Portugal.
On to Portugal.
We decided to leave Brazil and come to Portugal.
After working in so many countries, do you see the body and pain differently today?
No, pain is the same with everybody all over the world. There are different responses to chiropractic all over the world. In some countries, chiropractic is a lot more well known. For instance, in the United States, there's around 60,000 practicing chiropractors. Even in Brazil, there's over 1,500. The UK has around 4,000. Australia, 7,000 chiropractors. Here in Portugal, there's registered about 50 chiropractors.
Oh,
so,
okay.
The problem is that these other countries, of course, have chiropractic schools and education for chiropractic, where Portugal doesn't. So even Spain, where there's a couple of chiropractic schools, there's over 300, 400 chiropractors.
So why is the spine such a big deal, so important?
Well, the spine's important because the nervous system passes through the spine. From the brain up in the central, all the things happen in the brain, and then the spinal cord passes through the spine and out through the nerves to the organs. So any effect that the spine can have on the nervous system is a negative effect, generally a negative effect. What happens is that the joints in the spine, between the skull and the pelvis, we have 24 bones. 24 vertebrae. Each of those on each side has a joint that's supposed to move freely. Now, if we are sitting at office chairs, or we're sitting in cars, or we're sitting in sofas, or lecture theatres, school rooms, for years, these joints jam up, cause muscle spasm to happen, cause the pain to happen, and it also affects the nervous system. So the first sign is stiffness, the second sign is pain. But once you get the joints to start moving again, the nervous system can recover and start to function properly.
By the way, that clicking sound that we hear during the adjustment, what is it?
Well, it's inside a joint, any joint in the body. You might do it with your fingers.
I can do it. I can do it.
Okay. Well, inside a joint is a fluid. and wrapped in the fluid is a synovial membrane and ligaments, etc., and it's enclosed. And when we make an adjustment, we open that joint fractionally. And when we open the joint, okay, the fluid that's inside the joint to occupy the space of the new volume turns to gas.
Oh, okay.
And that's the click that you hear. It's not bones breaking or ligament snapping or spinal
Some
cord.
people love it. Some people get worried.
Yeah, a lot of people are scared by it, but it really doesn't mean a lot. It just sometimes happens. It doesn't even always happen. Sometimes some people will click easily in some part of their body and not so much in another part of their body. Sometimes people will click in their neck one way, but it won't click the other way. But it doesn't necessarily mean that the adjustment hasn't happened. It just means that one's a bit more easily to move than the other.
And when we are talking about adjustments, or micro adjustment,
that's the big thing. That's why it needs to be a qualified, registered chiropractor that does the job, because we understand that the adjustment is just it's less than a millimeter. Okay, it's high amplitude, low amplitude, high velocity.
Yeah.
So it's got to move just a fraction of a millimeter in a very small space of time, and that's what we practice for years to do. It's not like the James Bond movie, which is completely the opposite, where that's the high amplitude, reasonably high velocity also. But yes, that can do a lot of damage. So it's the fact that you've got to move something just a fraction of a millimeter in a high space of time.
A lot of people worry about safety. Is really chiropractic safe?
Chiropractic's extremely safe. When everything has a risk. The risk of having a serious, some sort of injury from chiropractic, particularly the neck, is supposedly about 1 in 5 million or so. Okay, when you compare that with long-term pain medication, which is the option that you get from the medical profession, it comes down to 1 in several thousand. When you come down to surgery, it's 1 in several hundred.
Okay.
So yes, although there is a risk, if performed by a qualified, recognised chiropractor, the risk is extremely minimal compared to the other options that people have.
And talking about that, what kind of training does a chiropractor have? How many years?
It depends on country to country. Most or all chiropractors have to have at least 4 years full-time university degree. That's the case in I think the UK and Spain and Brazil. It might be 5 years. In the United States, it's normally a second degree. So normally they've done some sort of preliminary degree, and then it's a master's degree on top of that. So it's somewhere between 4 years and 8 years full time. There's a worldwide body recognised by the World Health Organization that makes sure that the people teaching the chiropractic are qualified, and that they have, I think it's at least 4,200 hours face-to-face lectures. So that means at least 4 years to do that.
So is chiropractic probably regulated internationally? There's someone controlling, or?
Yes, there is regulation, but regulation is by country. Okay. So yes, there is here in Portugal. Yes, there is a regulation body, and you do have to be show your qualifications and be registered as a chiropractor. Other countries, less so. In of course, the UK, Australia, all the places I've been. Actually, no, Brazil. It's not actually regulated. There are 2 universities there, and they give qualifications, but there's no actually regulation body there. There is an association that chiropractors join, and also in Spain. I think that it's not regulated there as well. Here in Portugal, yes, but other countries, not necessarily.
Why do you think chiropractic is still relatively unknown here in Portugal? There's not a lot of chiropractors. People really don't. That's why we are having also this conversation.
That's part of the problem, is that because there's no teaching of chiropractic here. There's no universities that actually give out qualifications. Nobody knows about it. So, the only experience that a lot of people in Portugal might have with chiropractors is if they see foreign movies or foreign sports stars mention it, or something along that line. But yeah, it needs to be more known, and more people could receive benefit if that was the case.
Yeah, and do you think this will change in the future?
I'm hoping it'll change in the future. I don't have too much knowledge of the politics surrounding chiropractic in Portugal as such. There is an association here. There are, as I say, other Portuguese chiropractors that know a lot more about what's happening with chiropractic here in Portugal than I do.
Portuguese chiropractor?
I'm relatively new. Yeah, these Portuguese chiropractors, of course, have not been trained in Portugal. They've been trained in the United States or Canada or the UK or
that's
maybe
part
Spain
of the
or
problem.
Brazil.
The investment, the time investment is, and also the course will be very expensive.
Yeah. Well, I don't. I can't say what the cost of the courses are, but certainly, if someone wants to learn chiropractic, but at the moment, they'd have to go to Spain. So they'd have to know Spanish or English to learn chiropractic.
Yeah, but for a Portuguese, that's not a very big deal. Going to Spain to have this kind of degree.
Absolutely.
And we have 10 million Portuguese, and we have some market here for sure.
I'm not exactly sure. Unfortunately, there is a register for chiropractors, but not all the chiropractors that I know are registered are necessarily on the register. So there's at least 50 chiropractors, in Portugal, but it might be up to 70 or so. I'm not sure.
What's the most common reason people walk into your clinic?
Definitely pain. People walk in with either back pain, neck pain, upper back pain, headaches, or sciatica. And as I say, it's all a case of the joints in the spine not moving. Chiropractors have a different philosophy as to what causes pain. If you go to a chiropractor, will say that, yes, or 8 times out of 10, this is part of the thing, is you've got to have a good diagnosis to begin with. But chiropractors recognise that in our belief that 8 out of 10 times that people have back pain, it's going to be because those joints are not moving as they should be moving. If you go to a medical practitioner, they have a different view. They possibly think that there's a fracture, or there's a dislocation, or a herniated disc, or some other form of tissue that's causing the pain. And they'll send you for x-rays, or they'll send you for MRIs or CT scans. And when they come back negative, they don't accept necessarily that, they don't stop to think about the joints being the cause of the pain. And so they put people on medication, or they, if it gets really bad, they advise surgery. Where chiropractors have a different philosophy to osteopaths as well. Osteopaths are more the body as a whole is very good philosophy. But the body's back pain can be caused by other organs, so they will do muscle releases and organ releases and et cetera, et cetera. Then, of course, there's physiotherapy that thinks that everything, they diagnose that back pain comes mainly from either over-strengthened or under-strengthened muscles. So they give exercises for people to strengthen their core muscles or strengthen other muscles as well. So.
Do people often get surprised by the results?
Yeah, people who have had poor results in other modalities, if they've been to the doctor and they've been having medication and they're not getting any results, or they've been to physiotherapy and they're not getting any results, and then 1 or 2 treatments and we just get those joints to start moving, it can be dramatic, the difference in some people's lives. Other times, it takes if the problem is a herniated disc due to long-term degeneration, then the results can be a lot slower.
Yeah.
And of course, young people will respond to problems a lot quickly because they've had a problem a lot shorter time. Older people will take longer to respond because the problem's been there for many, many years.
And also, with only one visit, the problem will not be fixed, right?
Yeah, we're not going to get movement in the whole spine happening in one visit, that's for sure. Well, maybe that could be the case, as I say, in a teenager or a early 20s person, and they've had some sort of injury, click, click, we get them moving in 1 or 2 visits. But generally, if someone's older than that and they've had a problem longer than that, it will normally take 6 or 8 visits, or if it's an elderly person, maybe 10, 12, 15 visits to get the problem to start moving. The thing with elderly people, of course, they're much more fragile than you and I.
Yeah.
And so not only has the problem been there longer, but we've got to be more gentle with them in the process of getting the joints to start moving. So we've got to do more delicate techniques to
And
get
how
them moving.
about a sport guy?
Well, chiropractic's great for sports. First of all, with injuries, once again, a lot of injuries in a lot of sports people come about because those joints are not moving as they should be moving. But just because there's no pain sometimes in sport doesn't mean that the body's functioning as well as it could be. So restoring correct movement to the whole spine, for instance, in a golf swing or kicking a football, or all these sports that need balance and coordination. Tennis, yes. You've got to have all these joints moving as best they can for the person to be able to perform as best they can. So not only biomechanically getting the joints moving is better for the sports person. Once the joints are moving as they should be moving, the nervous system functions at a more optimum level too. So things like balance and coordination, etc., can be improved as well.
Do people need a doctor referral to come and see you?
No. People can just ring the clinic or a clinic. It doesn't have to be my clinic. It could be any chiropractic clinic. Just make sure that they're qualified and registered. But can call any clinic and just make an appointment. You don't need medical certificates.
How do you know if someone is actually right for chiropractic?
Well, anyone who's got a spine should have their spine checked out and at least examined to see if there's a problem. Most people have spines, so I would say anyone should be well. Of course, there are limits to that. People who have had a serious trauma, maybe been hit by a car in a car accident, that's not the time to come to a chiropractor. That's when you do need the doctor and you do need the hospital and you do need to get things put back together as they should be doing. A chiropractor can't help you when you can't. However, if it's not from a trauma and it's not from some sort of pathology such as a cancer or an infection of some kind, then and you've got unexplained pain, even extreme pain.
And also about one thing is about the headaches. So people suffering from headaches, they don't recall the spine. They think it's stress mostly. But
well, stress comes because when joints in the neck jam up and stop moving, muscle spasm happens in the back of the neck. That then refers to the front, and people start to get headaches in all weird and wonderful problems. But the problem's generally originating somewhere in the back of the neck.
And also about the ear ringing when you see the dee.
Oh, the tinnitus.
Tinnitus.
Yeah. I get it myself. I wish I could. It's something that I haven't been able to find an answer for with chiropractic. So there are limits to some things. But having said that, I did have a patient come in just the other day who said his tinnitus had only recently noticed. He might have had it for some time, and he felt as though that the chiropractic had improved it a bit. But I've had it myself for many years, and I haven't been able to get any relief from chiropractic.
My personal, I had a small relief as I started having your adjustments. I have I'm getting better. I still listen it, but I think was something that really
Okay.
helped.
Yeah.
And how about kids?
Treatment on kids?
Yeah.
Well, of course, kids have falls from a young age. My children were adjusted when they were, first adjusted when they were only, days old.
That's so scary for people,
yeah,
but
it's a tiny little adjustment.
just, of
It's
course,
it's
with
not-
your
you-
big
yeah,
hands.
you
but
only need to, basically, just touch the spine. But one thing I'm proud of is that a lot of kids during their, teething years and all that all have earache.
Yeah.
Earache's a big thing with kids because of the shape of the undeveloped head and the postures and the teething that's coming through. And yeah, my kids had, well, they used to complain about having earache, but the earache lasted 30 seconds after they told me about it because I know that some parents, their kids put up with earache for hours and sometimes days. But certainly mine, as soon as they said, sore,
all done.
yeah.
Do you think cost is one of the reasons not everyone has access to chiropractic?
Yeah. Ideally, chiropractic should be for everyone because everyone's got a spine. But yes, unfortunately, it's not part of the public health and it does come at a cost. Cost for some people is a lot. Some cost for some people is very little. Everybody's different in that regard. Unfortunately, at this stage, a lot of people have private health cover, an international private health cover in Australia or the UK, America. Private health cover does cover chiropractic, but as far as I know here in Portugal, it's not covered by the Portuguese health insurers as yet.
So, why do so many people have pain even when scans say it's everything normal? It happened with me. I had a back pain, and that's why I went for a clinic. I searched for a chiropractor. Needs to be. I was searching for many years. I went to the doctor. They give me pain meds. They do me a scan. Everything is good. You have a hernia and all good, but the pain was there.
Yeah. Once again, it's a typical example of it being a joint that's the problem.
But why doesn't the doctor tell me you need to visit a chiropractor? I pressed the doctor because I really knew the answer to see if I press him, he will give me the right answer. So, doctor, I'm still having the pain. I took the back pills. The MRI, it's all good. What should I do? Do you adjust? I told him that phrase. Do you adjust me? Do you have someone here that could... Why is that doctors don't suggest? Maybe just give us a hint.
I can't answer for doctors, of course. I suspect that it's just in their training that they don't think of, a reason for back pain might be that joints are not moving as they should be moving, because you've got to take into consideration when you have an X-ray or when you have an MRI or a CT scan, they either lie you down or sometimes with the X-rays you're standing, but generally they lie you down and they tell you to be very still whilst they take the image. And it is just a photograph. You can't tell if something's moving in that image or not, even when they do dynamic X-rays where they get you to bend forward and take the X-ray and get you to bend back when you take the X-ray. It's still not a video showing if things are moving or not. And I suspect that if they had the facilities or had the know-how to take video X-rays from the front and from the back and from the side, where they take all the static X-rays from, they would see that things are not moving in the spine as they should be moving. But they don't actually have the facilities to do
Don't
that.
they have a chiropractic class at health?
I don't think
just
so.
a little bit?
No, I don't think so.
God,
I don't. there's a lot of history between the medical profession and the chiropractic going back to the back over 100 years.
We have to
there's
call the you have to talk about this. The main thing is pharmaceuticals don't have appeal.
they don't have any vested interest in chiropractic.
That's the
for
only
sure.
explanation. There's no other explanation for the doctor not to talk about that because there's no pill for that.
Part of it is that I don't think that I do think that it comes back to the pharmaceuticals pharmaceutical companies, controlling the medical profession. I don't know if that's something I can get into trouble for saying, but yes, there is some sort
It's
of
your
control.
opinion.
Yeah, it's an opinion of the pharmaceutical companies controlling the medical profession. But I don't believe that doctors are taught in their schools that joint fixation could be a problem. It's just not. It doesn't.
Because
It doesn't
the
occur to them.
pharmaceuticals get through the school system
Yeah,
and they don't talk about it because there's no
this has been a problem.
profit to make about it.
I mean, chiropractic, osteopathy, I think, started in the 1860s. Chiropractic in the 1890s, and the medical association has been against chiropractic, and quite possibly at the beginning, deservedly so, because there was not enough research done. But certainly over the last 40 years, since the 80s, there's been a lot of research, in the 80s and the 90s, explaining how chiropractic works, and that chiropractic's all about getting proprioception correct in the joints, and reducing nociception, and all of these things that explain why pain comes from joint fixation. But still, it's not taught in the to doctors that this is an option. And I think slowly it's getting through.
And also social media is helping. We both have done some videos, and I watch thousands of guys doing videos in United States about adjustments, and people love it, and they have millions and millions of views, and people love to hear that crack and neck and back, and people are starting to
Realize that it's not dangerous, and that Having said that, there are some cowboy chiropractors out there that I'd like to point out that, in my opinion, is not chiropractic. Some guy in Texas or something that does some ring dinger that where he just yanks on the whole spine all at once.
I've saw.
Chiropractic's all about being a specific contact in a specific direction, with a specific amplitude and a specific velocity. And this guy just seems to go
Everything
with
everything goes.
everything. So that, in my opinion, is not chiropractic, and you won't see anything from that from me or from other chiropractors, I'm pretty certain, in Portugal. That's just his marketing tool.
Taking back to, can chiropractic affect things like stress and tension? We are living in a stress life every day.
Absolutely, yeah. Joint fixation, lack of proprioception causes nociception. Nociception is the key to increased heart rate, increased blood pressure, etc. So increased muscle spasm. So absolutely, when a joint is not moving and the muscle becomes the muscle around it tightens up and becomes tight, yes, the body becomes overstressed. So restoring correct muscle spasm,
Anxiety also.
absolutely, yeah. The nociception affects not only the body physically, but the body emotionally and biochemically as well. So,
And can also help prevent degeneration.
Degeneration comes about. This is where people are misinformed again as well. Is that doctors tend to tell people that as you get older, the body will, you'll have degeneration, particularly spinal degeneration, bicu de papagayo, etc. But degeneration actually comes about because a joint has not moved for a long time. Okay,
Years.
so the joint fixation causes, in the long term, causes the degeneration. How do we know that? Because in the spine, okay, a lot of people, not everybody, but a lot of people will have areas that jam up and become degenerated, and they'll have other areas that are moving freely and they don't have degeneration. Now, the whole spine, of course, is the same age.
Yes.
So it's only the areas that have been jammed up and not moving that are slowly degenerating. Back in the 80s, Weidman, I think it was, that did a study that showed that if a joint in the body is immobilized for less than 2 weeks, microscopic degeneration starts to happen. So it only takes a couple of weeks of a joint being immobilized for degeneration to start happening. Now that happens, the bony degeneration in the spine, and also the disc degeneration, because the disc between where a joint is jammed up and not moving, okay, has a disc between it. Okay, the disc gets its nutrients from movement of the joint. And so if the joint is not moving, the disc doesn't get its nutrients. It doesn't get its water. It doesn't get
flow,
its hydration.
Yeah.
And so, over time, the disc will degenerate and start to bulge. And then people go in their 40s or their 50s, they go to get an MRI scan done, and the doctor says, well, you've got the start of a disc herniation there.
Yeah.
Yes, that's the start of a disc, but it's not what's causing the pain. What's causing the pain? If someone has a disc herniation and they've got numbness in their leg or pins and needles or weakness or problems in their legs, okay, that can be what's being
causing
caused.
the pain.
Yeah, that can be the effect of the disc, because a disc itself doesn't conduct pain. It conducts pain. It doesn't cause pain. So touching a disc is not necessarily painful, or compressing a disc is not necessarily painful. It stops the flow of what's happening through the nerve.
Yeah.
I've said the wrong thing, but if you compress a nerve, it doesn't feel the pain, but it stops the transmission of what's through the pain. So it causes weakness, or it causes sciatic pain, or it causes numbness. But the pain in the back that people are feeling is the joint not moving.
And what about those expensive mattresses and magic pillows people buy? Do they really help?
Most of the time, it's not the people will blame their bed.
Yes.
And if you do have a bed that's more than 15 years old, or and is really soft, or it's gone, sure, replace the bed. That might be the answer. But more often than not, when people have a decent bed, it's the fact that they sleep on they fall asleep on the sofa, or they lie on the sofa for a couple of hours before going to bed, finally get up, bit stiff, but get up, go to bed, wake up in the morning with back pain, and then blame the bed, when in actual fact it's the habit of lying on the sofa beforehand. The same with the neck. People blame the pillow, or they want to buy the magic memory foam pillow or whatever. It's because the neck is all jammed up and not moving properly that they wake up with back pain. It doesn't matter what pillow you're going to have, supporting the neck or whatever. If the neck is moving fine, okay.
Yeah, for me, I have that. I switched mattresses, I guess, 2 or 3 times because I was having back pain, and as soon as I started moving, having some sports, doing some workouts, we think it's about the muscles, but you already told me it's because everything start to move. Your spine start to move, and I don't have pain.
Muscles tighten up to protect the joints. So if
it's not the other way around.
If you've got joint fixation happening, the muscles will tighten up to protect those joints. Yeah, it's not the other way around. Yeah. But people just diagnose the muscle spasm, not the cause of the muscle spasm. Get to the cause of the muscle spasm. You correct.
You just need to try to relax a little bit the muscle for you to have movement to adjust. Okay.
If the joint becomes really jammed up and inflames, that's when people have acute pain.
Yeah.
And yes, you've got to reduce the inflammation first. Before you can try and adjust it, because it's too painful to adjust if you don't reduce the inflammation. So reduce the inflammation, get movement back into the joints, the muscles will relax. Yeah. And of course, exercise is essential for everybody. Exercises such as with movement, such as Tai Chi or Pilates or yoga, fantastic. But the essence is that a chiropractic adjustment will loosen up that joint, in a fraction of a second, a couple of times in a week. Yep. So within a week, you'll get more movement in that joint than if you spend an hour doing Pilates every day.
It takes longer.
It takes longer. It will get you there.
It will get you there, yeah.
It will get you there, but generally it takes longer.
How should someone choose a chiropractor? The nearest one?
Yeah, well, generally, as I say, make sure they're registered.
How can we know that they are? There's
a lot of the time it goes on faith, but you do have to ask. At the clinic, how long's the doctor been? And I get that quite often. How long have you been practicing? Where did you get your degree from? And you can then check up, if the chiropractor's done the degree in the
and
correct
just to be clear, it doesn't need to be you, of course.
No, especially if people want someone who speaks better Portuguese than me. I mean, my Portuguese is mais ou menos.
Mais ou menos. Bocadinho brasileiro, Brasil.
Pouco.
Pouco.
So I speak a bit of Portuguese, but if particularly elderly people who speak no English at all, if they want to visit one of the Portuguese chiropractors, they're better off doing that than not doing anything.
What would you say to someone who's curious but still unsure?
Research. AI these days has the answer to everything.
ChatGPT. Just ask it.
Yeah, just ask Gemini.
I'm thinking about visiting a chiropractor because I have a back pain. What do you think, ChatGPT?
And ask if these people are recommended by others, and ask if they have qualifications or where their qualifications are from. But you can certainly find out these days so easily about chiropractic if you choose to do it. And you can do it, of course, in Portuguese. ChatGPT speaks Portuguese.
Speaks Portuguese from Portugal.
Yes. Yeah, so there's do the research.
And
if someone's suffering from back pain and hasn't had results elsewhere, because most of the time, if people are suffering from back pain, they're not suffering in silence. They've tried this, they've tried that, they've tried something else. But and even chiropractors can be different. I practice differently to a lot of my colleagues.
Yeah.
So some chiropractors are very gentle. Some chiropractors just specialize with children. Some chiropractors, specialize with older people. And as I say, if language is a factor, distance is a factor. If you're up in the north of Portugal and I'm in Lisbon, or there are plenty of chiropractors up in Porto. There's plenty of chiropractors down on the Algarve. You don't have to come to Lisbon and it in fact defeats the purpose if you travel 3 hours to see a chiropractor and then have to travel 3 hours back in the car to
the problem will
by the time you get home again, well, it won't be worse. Things will slowly get better, but it'll be a lot slower than if you can visit someone that's a lot closer and get the problem sorted out sooner.
That's it. We'll leave the number here on the screen for people to call you and make an appointment. If you have a clinic right near Marquês de Pombal, right on the roundabout, and also in Cascais Parede, you have also a clinic that Tuesdays and Thursdays on Parede, and Monday, Wednesday, and Friday in Lisbon. And they need to call you and make an appointment.
Just make an appointment. If they can speak English, that's fantastic. If they can't speak English, that's not an issue also. We can get by.
Yeah, we can buy. Thank you so much.
Thank you kindly for having me.
Thank you.